Good day, ma'am. So today I'm going to perform assessment of the abdomen return demonstration. So first, let's prepare for the knowledge. So I need to describe the structure and function of the abdomen.
The abdominal is bordered superiorly by the costal margins, inferiorly by the symphysis pubis and inguinal canals, and laterally by the flanks. It is important to understand the anatomic divisions known as the abdominal quadrants, the abdominal wall muscles, and the internal anatomy of the abdominal cavity in order to perform an adequate assessment of the abdomen.
Okay, so now, before I'm going to start, I need to introduce myself to the client. So, hello ma'am, I'm Joyce Abriagoto, your student nurse of CSPC. And verify the client's identity. What's your name po?
Emilia,
Okay, and your birth date?
May 16.
Okay, so next is explain the procedure to the client. So, ma'am, today I'm going to assess your abdomen. I will inspect, palpate, auscultate. And so, later on po, mahawakan ko po yung inyong abdomen. Okay lang po ba yon? Okay, so next is I need to gather equipment. So, here are the equipment that I need to use. Okay, and then next is perform hand hygiene. Provides for client's privacy. So I need to close the curtain and then of course the door to have a client's privacy. Okay, and then after that, inquired clients for her health history. Okay, so ma'am, I will ask you some question po related to your health history. Okay lang po ba? Okay, so do you experience indigestion po? Nakakaramdam po ba kayo ng mga indigestion sa inyo? Okay, so have you had ulcer, acid reflux, or liver disease? Okay, so has anyone in your family have any type of gastrointestinal cancer? Okay, so nag-exercise din po ba kayo? Okay. So, thank you ma'am for your response. So, we need to next is now let's start for the physical examination of the abdomen. Okay. Okay, so first inspect abdomen for skin, noting color, vascularity, stray, scars, and lesions. Okay, so inspect the abdomen. Okay, next is inspect umbilicus, noting color, location, and contour. Okay. And then, inspect abdominal contour. Okay, and then inspect the symmetry of the abdomen. And inspect abdominal movement, noting respiratory movement, aortic pulsations, and or peristaltic wave. Okay.
Okay, the findings: abdominal skin may be paler than the general skin tone because this skin is so seldom exposed to the natural element. Scattered fine veins may be visible, and then new striae are pink or bluish in color. Abdomen is free of lesions or rashes. Flat or raised brown moles, however, are normal and may be apparent. Umbilical skin tones are similar to surrounding abdominal skin tones or even pinkish. Umbilicus is midline at lateral line. It is recessed, inverted, or protruding no more than 0.5 cm and is round or conical. Abdomen is flat. Abdomen is symmetric. Abdominal respiratory movement may be seen, especially in male clients, but my clients is female, so a slight pulsation of the abdominal aorta, which is visible in the epigastrium, extends full length in thin people. Normally, peristaltic waves are not seen. Okay, next, auscultate for vowel sounds. A series of intermittent, soft clicks and gurgles are heard at a rate of 5 to 30 minutes. Hyperactive vowel sounds referred to as Borborygmus may also be heard. These are the loud, prolonged gurgles characteristic of one's stomach growling.
Okay, next, auscultate for vascular sound and friction rubs.
Okay, findings. Brutes
For
are not normally
aorta,
heard over abdominal aorta or renal, iliac, or femoral arteries.
okay,
However, brutes
and
confined to systole may be
renal,
normal in some clients depending on other differentiating factors.
then the
Okay, and venous
iliac
hum is not
artery,
normally heard over the epigastric and umbilical areas. No friction rub over liver or
then
spleen is
the
present.
femoral artery. Okay, next is percuss the abdomen for tone. Okay.
Generalized empathy predominates over the abdomen because of air in the stomach and intestines. Dullness is heard over the liver and spleen. Dullness may also be elicited over a non-evacuated descending colon.
Okay, next is percuss the liver. Okay, this is the liver.
The normal liver span at the MSL is 4 to 8 centimeter.
Okay, next is perform the scratch test.
The scratch test has been found to have higher reproducibility.
This is the scratch test. Okay, next, percuss the spleen.
The spleen is an oval area of dullness, approximately 7 centimeter wide, near the left tentrive.
Okay, and the next is perform blunt percussion on the liver and the kidneys.
Normally, no tenderness is elicited.
Okay, next is perform light palpation, noting tenderness or masses in all quadrants. Okay.
Abdomen is non-tender and soft. There is no guarding.
Okay, and the next is perform deep palpation, noting tenderness or masses in all quadrants.
Normal or
Okay.
mild tenderness is possible over the xiphoid aorta, cecum, sigmoid, colon, and ovaries with deep palpation.
Okay, and then next, palpate the umbilicus.
Umbilicus and surrounding area are free of swellings, bulges, or masses.
Okay, and then next, palpate the aorta.
The aorta is approximately 2.5 to 3 centimeter wide with a moderately strong and regular pulse. Possibly mild tenderness may be elicited.
Okay, next is palpate the liver, noting consistency and tenderness.
The liver is usually not palpable, although it may be felt in some thin clients. If the lower edge is felt, it should be firm, smooth, and even. Mild tenderness may be normal.
Palpate the kidney.
Okay, the kidneys are usually not palpable. Sometimes the lower fold of the right kidney may be palpable by the capture method because of its lower position. If palpated, it should feel firm, smooth, and rounded. The kidney may or may not be slightly tender.
Okay, and then palpate the urinary bladder.
An empty bladder is neither palpable nor tender.
Okay, and the next, palpate the test for shifting dullness.
Dullness remain relatively constant throughout position changes.
Okay, and the next is perform the fluid wave test.
No fluid wave is transmitted.
Okay, assess for rebound tenderness.
No rebound
Okay.
tenderness is present.
Okay.
No referred rebound pain is elicited.
Okay, and then the assess for Pessoa sign.
No abdominal pain is present.
Okay, assess for obturator sign.
Okay, no abdominal pain is present.
Okay. Okay, for the aftercare, formulate nursing diagnosis, formulate collaborative problems, and make necessary referrals. And then, perform hand hygiene again. Okay. So, ma'am, tapos na po yung ating procedure. So, thank you very much po for your collaboration. So, ano pong nararamdaman niyo ngayon? There are any pain po? Okay, so thank you po. So, that was it.